Hi, I'm Dr. Jenny. I'm a chiropractor here at Head to Toe Spine and Sports Therapy, and I'm going to be doing 4 weeks, 4 short videos talking about your hips. Now, why would you care about your hips? Well, maybe sometimes you wake up in the morning and your hips feel a little bit stiff, or you're sitting down, you go ahead and stand up and you're like, oh, maybe your hips just aren't doing quite what you want. Or maybe sometimes when you take that first step, the hips just like, ooh, kind of a deep hip pain in here. Or maybe, you're at the gym and you're doing your workouts, you're trying to do this nice deep squat and you just can't get deep as you want. So this series is for you, and we're going to go ahead and get started. There are 3 main things that you need for good hip mobility. 1, the muscles that attach to the hips all need to have adequate length. The second thing is that the hip needs to be able to move within its hip socket. And the third thing is you need to have good control over moving the hip separate from moving the pelvis. So those are the things I'm going to be covering. Glad you're joining me. Okay, so the first set of stretches we're going to do to help your hips move better, to feel better, is we're going to be stretching out this muscle right here called your psoas. It's your main hip flexor. So I want you to get into a position just like this, and notice you want your pelvis to be nice and parallel, pointed forward like this, and you don't want to lean forward, you don't want to lean back, you want to have your core nice and engaged. You're going to put your arms up just like this, you're going to push forward, and you're going to lean over to your right. Just like this. And where you should feel that pull, you're pushing this hip forward, you should feel it right along here. Okay? So I'm moving forward, bending over to the right. I'm holding that 5 to 7 seconds, 8 to 10 seconds, and then come back and then repeat. Then you want to switch legs. Same thing. Hips are facing forward, arms go up. I push this hip forward. I don't lean forward, I don't lean back. Just like this. Lean over to the left side. Hold it 8 to 10 seconds. Come on back and repeat. Now you might find that one side is much tighter than the other, and the body works very well with symmetry. It likes to have the same length on one side versus the other. So work to even them out so that they both feel the same. Next stretches we're going to do are for the inside of your thigh right here. Okay, so you're going to sit just like this. You're going to put your legs out. You're going to hinge right from your hips, which means you're not bending your back like this. You're keeping your back nice and flat. You're hinging forward, and you're just going to feel the stretch all in here. Okay, just go as far as you can. Hold it a good stretch. Hold about 8 to 10 seconds. Relax. Come on back up. Keep yourself cores engaged, hinging from the hips, and I'm bending forward just like this. Okay, and then come on back up. Next one we're going to do, stretching the same area, is we're going to put our feet together like this. A couple variations on this, but essentially you are bending at the hips again, keeping your back flat, so we're not doing one of these. Take your forearms, put them on your legs right here, and I like to add a little bit of overpressure to my legs as I'm bending forward. So I'm sitting up nice and straight, I bend forward, and I'm pushing down on my legs. Okay, hold it 8 to 10 seconds. Come on back. Relax, and then repeat. Just like that. Okay? Good. Okay, the next exercise or stretch actually that we're going to do is for your hip capsule. We have to have good mobility within that hip capsule. So we're going to start out on all fours. My legs and my shoulders are both shoulder width apart. And I'm going to take one leg and I'm going to put it right behind my other leg. And I'm going to then lean my hip, now not my shoulders, but lean my hip directly that way, directly to the side. And you're going to feel a stretch right along here. And imagine that you're trying to push this bone right through the back of your hip. Okay? So here I am, and I lean over to that side, really get a good stretch there. Hold it 8 to 10 seconds, come on back, and then repeat. And then of course repeat on the other side. Second one we're going to do is going to do more the posterior part of the hip capsule. So this time you're not leaning to the left, you're not leaning straight back, you're leaning right on a diagonal. And again, imagine that you're taking this bone and it's poking right through your, right through the hip right here. Okay, so I'm going to come back on that diagonal and I'm really going to feel a good stretch there. Make sure you don't move your shoulders are staying here, hips going back. Hold that good 8 to 10 seconds, relax it, come on back up. All right, go ahead and give that a try. Okay, so thanks for joining me for this video. If you find that these exercises are helpful, awesome. Tune in next week and we'll do some more. If you find that you're doing some of these and maybe they're making your hips a little more sore, come on in and see me and let me see what I can do to help you out a little bit more. Thanks much.